You are welcome to this cranial nerves examination in Masterclass Psychiatry and Medicine. I'm Dr. Prosper Tettey in the United Kingdom. I'll give a brief outline of the 12 cranial nerves and the functions that they play. The first cranial nerve, which is the olfactory nerve, is to test for abnormal smell. The second cranial nerve is to test for visual acuity, visual fields, and then do a fundoscopy. To test for the third, the fourth, and the sixth, do what is called the H movement of the eye by moving the hand across like this in an H sign. And also, in addition, nystagmus. Look for nystagmus. For the fifth cranial nerve, test for sensory as well as the motor aspects. The motor by asking patient to clench the jaws and feel for the masseter. The sensory usually have three parts which one has to test for on the face. The eighth cranial nerve tests for sensory as well as motor. The seventh cranial nerve tests for sensory as well as taste, which is the sensory, and the motor, which is to ask the patient to raise the eyebrow and then test for that. And then the next cranial nerve, which is still the seventh. The sensory is for taste, and then the motor is for raising the eyebrow, smile, blow out the cheeks, or shut the eye against resistance. The eighth cranial nerve is for hearing by whispering behind the patient. And then ninth and the 10th are tested together. Observe the palate as with the mouth open of the patient, and observe the uvula and ask patient to say ah. The next is the 11th cranial nerve. Ask patient to shrug the shoulders against resistance, and also to deviate head against resistance to one side and then to the other side. And the 12th cranial nerve is to ask patient to protrude the tongue and move to the left and to the right side and see if there's any deviation of the tongue. So ladies and gentlemen, this is the end of the presentation, and I wish you all the best in your career and also all the best in your studies.